Wow.
Dr. Stu, it's so great to have you here.
It's an honor to be here, and I just have to say, the last segment was, you covered so much that's so true, and I, as a male physician, feel a little embarrassed. But I walk in the footsteps of all the midwives that came before me and taught me what I didn't necessarily learn in residency.
I see, look, listen, men can give credit to women. It's great. Thank you, thank you.
You're welcome.
You know, you've been in this field for so long. Why do you think there's so much fear around childbirth?
Because fear is the strongest emotion that you can control people with. And I think the reason that we have so much fear in the Western medical world is because the people that are practicing, the doctors, are taught to fear birth. They're taught birth is a medical condition, that it needs treatment, that it's chaotic, and that we have to control that chaos. And so they're fearful, and if you talk to most birth workers, they have that sense of fear, and then they project it onward to the women of America and other countries. And so, and it's all you see. I mean, not that the media is always bad, but sometimes there's a lot, when you see birth, and it's very dramatic. And it's, and there's a lot of fear. And so it's propagated that way, and then you can control people when you have fear.
Yeah.
Right.
Yeah, it's a very good tool. And, and childbirth can be such like a lovely thing. And it should be a lovely thing, because, we are all, we're all born at some point. And it's just, your entrance into the world is, I think, significant.
And if I could say, if we just take a step back for a second and we look at how other mammals do it, this can give us a vision into why what we're doing is not working so well. Because when a mammal goes into labor, where does she go? She goes off by herself. Who does she go with? Nobody. And when she's hungry, she does this amazing thing, she eats. And if she's thirsty, she drinks. And if she's uncomfortable, she moves. And if she's interrupted in labor, say the predator approaches or the little kids run into the bedroom, the mammal will put out hormones like adrenaline, which will stop their contractions, and they'll get up and they'll run away. And only when it's safe will labor return. And this way, nature ensures that the best chance of success. So what we do in the medical model is essentially antithetical to nature's design. From the moment a woman gets in her car to drive to the hospital, and actually I would say all through the prenatal care period too, to the moment she puts her baby in the car seat to drive home, pretty much everything that's done to the woman is opposite of what nature has designed. And it's not surprising that labor then doesn't go as well as it should, that we have such high intervention rates. 30–40% C-section rates. Some countries it's 70 and 80%. We're inducing women. 30, 50, 80% of women in certain hospitals are being induced. I mean, how many cows get induced? It's just the medical model sees birth as a problem. The midwifery model sees birth as a normal function of a woman's body. That they trust that nature has a design, and every time you intervene in that design, you will cause some ripple effect downstream, whether immediate or later.
Yeah, and it's interesting because I think we forget that we are animals, because, and particularly in birth, in my case, it's like it was the most animal you feel. You end up, you're in these positions where you're like, I never pictured, I didn't know how my birth would go, and I never pictured what actually happened, but it was like, you get in these, whatever positions most comfortable, you're making these guttural sounds you've never made before, and all of it's just happening to you. And I was lucky enough to experience in a way that, where I was at home and it was comfortable, and I was allowed to do all those things.
Yeah, if you let a mammal do, or a woman do what she wants to do, it's amazing to watch how they will move, they'll do something. The baby's not sitting right in the pelvis. Instead of laying on their back with an epidural numb and they can't help their baby, they can move. You'll watch them. They'll put a leg up on the side of the bed. They'll squat. They'll get on all fours. They'll do certain things. The medical model has taken all that away. And now we're stuck with, 80% of women getting induced, and in some hospitals, 90% of women getting epidurals. And that breaks that connection that women and their babies have, it's a beautiful symphony of hormones that's been going on from the moment of conception. And once that gets interrupted, the baby's sort of left on its own to fend. When a woman gets an epidural, its mom is no longer being able to help it. And so you see that, like you described in your last segment, you see that change in the fetal heart rate, and then we've got to do something. And then they get a baby that's perfectly fine from a C-section, and they say, great, we saved your baby. And actually, it was all the iatrogenic stuff that happened in the first place. Midwives, on the other hand, because they trust births so well, and they accept uncertainty. And I can tell you from experience, and I've been doing this for like 40 years, the first 28 of them I was in the hospital, the last 12 or 13 I was in the home birth world. We don't see that sudden deterioration of fetal status that you see in the hospital when you don't meddle with Mother Nature.
Yeah, and you know, I think we really undersell like how you come into the world is important, and I wish more women knew that this was an option even, because a lot of women they would never even, you know, it's become like it feels like people are like, oh, this like kind of alternative like woo woo, you know, like, oh, you're very odd, you had a home birth, and I was like, I don't know, maybe I'm lazy.
No, I mean people will often. This is an interesting thing when we talk on the podcast, we talk about the C-section rate being too high or epidural rate being too high. We'll get letters or direct messages or whatever that tell us that we're shaming somebody. We're not shaming anybody, but they're starting to project a little bit of their own guilt on the fact that maybe things didn't go the way they wanted to. All we want to do is let people know that they have these choices and these options, and that's not something you're getting in the medical model. You can't do in a 5-minute, 6-minute prenatal visit what a midwife does in an hour prenatal visit. You just can't. And I feel for my colleagues that are sort of in the hamster wheel of the medical model that they can't get out, because the one thing that's really happened that in my lifetime that I saw that was really bad was doctors became employees of hospitals and hospital systems. And then their loyalty and their fiduciary duty became compromised, because as a solo practitioner, my responsibility is the woman that I'm caring for. As a doctor working in a hospital setting, if they don't want you to do VBACs, vaginal birth after cesarean, or they don't want you to let anyone go past 41 weeks, then you'll have to skew your counseling to get the woman to do what your system wants to do, not what the doctor wants to do. And you know, I don't know that there's a lot of happy obstetricians out there. I don't think that a lot of them really like what they do, and that's why a lot of them give up OB. They go through all that training and then they come out and they just don't want to do it anymore. A lot of nurses leave nursing, they leave OB nursing because they just can't watch what goes on there.
And my experience with a midwife is that I got a lot of prenatal care, which is very important, but I also got a lot of postnatal care, which is also very important. You know, my midwife came to my house every day after the birth, and then, you know, like every couple days, and she was very involved in the afterbirth process. And I think that's also something that's missing. It's almost like you have the baby and then you're pushed out of the hospital, like literally in a wheelchair, and then it's like, bye, good luck.
See you in 6 weeks.
Yeah.
When I was a resident, you never see a normal birth as a resident because you're not watching a woman in labor. You're called to the delivery room or to the labor room when the nurses need you to do something. So they never watched like the sounds that you make or the things that you're saying, the guttural sounds or the movements that a woman that makes. You never know what the normal progress of labor is. So nothing is moving fast enough. So every time you're called to the room, you're asked to do something. You put on a glove, you do a vaginal exam, you order Pitocin, you rupture membranes, you do these things. And this is how young doctors are being trained to look at childbirth when they really should back off. Maybe 15% of women need medicalized hospital-based care. The other 85%, if the hospitals would leave them alone, could do it without much intervention at all. The problem is that hospitals don't make money doing nothing. They make money doing something.
Yeah.
And so they won't do that. And they will not leave a woman alone. And they can't make a hospital more home-like. Adding curtains and a hardwood floor to a labor room doesn't make it more like home.
Right.
They don't know how to leave a patient alone. They just don't know how to do it. And even calling them patients, I just made an error. We call them clients in our world because they're not sick. It's like breathing or it's like digestion. These are These are innate functions of our body. They're primitive brain functions. Fortunately, most of us don't have to think about breathing or digestion. Can you imagine thinking, breathe in, breathe out,
Right,
breathe in?
yeah.
You can't do that. But when you have pneumonia or when you have colitis, you need a doctor. But you don't need a doctor to breathe or to digest food or to get pregnant or to go through your prenatal care or to deliver a baby. These are all natural functions that nature has designed. And again, I want to reiterate, every time you intervene in Mother Nature's design, there is going to be consequences. Even my co-host Bliss likes to say, even if when you walk in the room when a woman is in labor and you quietly ask them, can I get you anything, or how are you doing? You're actually bringing them out of their primitive brain into their cognitive brain, and you're slowing down the labor process.
Yeah, it would be nice if we could just believe, women can do it.
Well, I'm living proof that they can.
Yeah.
And I'm living proof that somebody who went through the medical model, I was trained in a very academic program. I was actually very lucky because the program I worked at was affiliated with a very, very busy hospital. It's actually the busiest hospital in the country back in the early 80s. And so I learned the breech and twin, but I also learned that it was a medicalized process. And only coming out and being open to the fact that I was approached by midwives to take their home birth transports. And I didn't do it because I thought midwifery was smart or home birth was smart. I probably thought it was stupid, like most doctors do. But I did it because I wanted to make money in those days.
Right.
But I was prescient enough to listen to what the midwives had to say and to learn from the women who were in labor that they didn't have all the things that I thought they needed, and they still did fine.
Right.
Right.
Yeah.
Amazing. It's amazing.
It really is amazing. Thank you so much for coming on to talk, and thank you for doing the work that you do. I really appreciate it.
You're welcome. Can I say one more thing?
Sure.
Today is my daughter's 27th birthday, and I want to wish my daughter Madeline a very happy birthday.
Happy birthday, Madeline. Be sure to check out Dr. Sue's Birthing Instincts podcast and website.